Blepharoplasty obviously is the most is it's basic, right? Now, who might be a good candidate for the basic procedure?
So upper blepharoplasty, good candidates for people who have a lot of excess skin or a lot of excess fatty tissue in the upper lids, which makes the upper lid very, very heavy and droopy. A good candidate for lower lid blepharoplasty is people who have eye bags, under eye hollows, dark circles, wrinkles under the eyes. So those are good candidates for lower lid blepharoplasty. Oftentimes we do them in combination, upper and lower together. Fillers has been something that people have been doing for quite a while, but now there's a shift moving away from dermal fillers towards surgery because of people are looking for something that's a bit more long lasting, first of all,
And natural looking.
more natural.
Now, facial fat transfer is designed to inject fat back into the affected areas to help restore the facial volume and support the areas of the face that make it look youthful. What is your recommendation?
Traditionally, when people were looking at doing facelifts, they're looking at stretching the skin in this direction, and that was the only way of rejuvenating the face. But the thing is that as we age, there are three things that are happening. You are definitely getting descent of the face, so things start to droop down. So the brows tend to come down, so you get a lateral brow droop. You can get a mid-face or lateral cheek droop. Nasolabial folds come down. So there's a downward descent to the facial structure. So muscles and tendons tend to come out. But you're also losing volume too in the face. So a lot of important facial fat pads, medial cheek fat pad, temples, lips start to lose volume. That's an important part of the aging process. And the third part, which is super important, is the skin. The skin is also aging. It's getting thinner and it's becoming more wrinkled. So if you think about rejuvenating somebody's face, you want to address all three components of the aging process. So now the modern fat grafting techniques, what we're doing now is we're taking the fat and then we're filtering the fat through a process where we're using this filtering system where we're getting smaller and smaller fat molecules. And then the fat molecules that we're getting look very much like fillers. So we can be very, very specific and targeted and revolving.
Fascinating. Now, I know that in your practice, you have incorporated carbon dioxide therapy, particularly in procedures like blepharoplasty or ptosis repair and brow lifts. Can you speak to me more about this?
Yeah, so the way it came about is that, so as part of the blepharoplasty surgery, I also do a lot of CO2 laser resurfacing. So CO2 is like my mainstay for tightening the skin around the eyes, so wrinkles, fine lines, and it does an amazing job at that. However, one of the downsides of this particular laser is that there could be a prolonged healing time where the skin is a bit red and swollen, and sometimes it can be red and swollen up to 2 weeks after your procedure. So I came across the CO2Lift or the Carboxy in an effort to, I was researching at ways of decreasing my recovery time for my patients, because everybody wants to recover quicker. They want to go back to work. They want to go back to, and I started using that post lower blepharoplasty with laser resurfacing. And I had some amazing feedback from my patients, but also I was able to observe it myself when they were coming back for their follow-ups at the 1 week point. There was less redness, less swelling, and the recovery was a lot quicker.